Good morning. With me here today, I have our great Secretary of Education, Linda.
6:14 a.m. Detroit, Michigan. Tuesday. The neighborhood of Palmer Woods had not yet stirred. Gas lanterns cast amber pools across manicured hedgerows. A red-tailed hawk perched motionless on the stone gatepost of a $4.2 million Tudor revival estate on Strathcona Drive, a home registered to a medical foundation, tastefully appointed, professionally landscaped, above reproach in every visible dimension. 47 federal vehicles were already in position. At 6:17 a.m., Agent Supervisory Director Carla Pittman of the FBI's Detroit field office pressed her radio transmitter once. No speech, no dramatic announcement, one click. The hawk scattered into the gray Michigan sky. The gates came down. The man behind the marble, to the board of the Great Lakes Medical Consortium, Dr. Adnan Sharif Mukhtar, was a visionary. A 52-year-old Somali-born physician who had navigated the American medical establishment with impeccable credentials, with board-certified in nephrology, published in the New England Journal of Medicine, decorated by the Michigan Health Excellence Initiative in 2019. Mukhtar had, by every public measure, become a model of immigrant achievement and institutional leadership. His name appeared on the donor walls of 3 Detroit hospitals. He chaired 2 nonprofit foundations. His face graced the cover of Crane's Detroit Business in March 2022, beneath the headline, "Healing the City, How One Doctor is Rebuilding Detroit's Healthcare Infrastructure." That infrastructure, federal investigators now allege, was a trafficking network generating an estimated $1.5 billion in criminal proceeds over a 7-year operational period, the largest organ trafficking enterprise ever prosecuted on American soil. How it began? It did not begin with wiretaps or informants. It began with the corpse. In September 2023, a 34-year-old Somali refugee named Ifra Warsame was found unresponsive in a budget motel room off Route 94 near Dearborn. The cause of death listed on the initial county medical examiner's report was cardiac arrest, routine, sad, filed. A junior technician at the Wayne County Medical Examiner's office, a 26-year-old forensic pathologist assistant named Devontae Simmons, noticed something that did not belong in a cardiac arrest case. The surgical scar was less than 9 days old, clean incision, professional closure, but both kidneys absent. Simmons flagged the report to his supervisor. His supervisor escalated it to the state health department. The state health department contacted the FBI. The clock started, building the case. What followed was not a sprint. It was a 14-month marathon of painstaking forensic and financial excavation conducted jointly by the FBI's Organized Crime Unit, ICE Homeland Security Investigations, the Department of Health and Human Services Office of Inspector General, and the Treasury Department's Financial Crimes Enforcement Network. Investigators pulled the medical records of 317 individuals admitted to consortium-affiliated clinics over a 30-month window. They found 89 cases bearing the signature pattern: low-income patients, predominantly Somali and East African immigrants, presented for unrelated complaints, but underwent undisclosed surgical procedures under sedation, were discharged with falsified post-operative documentation attributing their recovery to unrelated interventions. 89 people had organs removed without their knowledge or consent. Kidneys, liver segments. In 11 cases, corneas. In 4 documented cases, a single lung lobe. Each organ was matched, packaged, and transferred through a logistics infrastructure that federal prosecutors describe as medically sophisticated, deliberately compartmentalized, and operationally ruthless. Refrigerated courier vehicles, Rinon, registered to a pharmaceutical supply company in Livonia, Michigan, transported organs to 3 clandestine surgical suites identified during the investigation, one in a repurposed industrial building in Hamtramck, one embedded within a legitimate outpatient clinic in Windsor, Ontario, and one operating from the lower level of a private residence in Grosse Pointe Park. The buyers? Wealthy recipients across 17 countries. Invoice records seized from encrypted servers in Cyprus show individual organ transactions ranging from $180,000 to $2.3 million. The higher figures associated with pediatric compatible tissue and rare blood type matches. The revenue moved through a labyrinth of shell companies registered in the Cayman Islands, Cyprus, the UAE, and Delaware. The network. Mukhtar did not operate alone. He was, in the language of federal charging documents, the primary architect and operational director of an enterprise that required the active participation of licensed medical professionals at every tier. The 23 surgeons have been arrested in connection with the investigation. Their jurisdictions span Detroit, Chicago, Toronto, Houston, and Atlanta. Among them, a former chief of transplant surgery at a major Chicago academic hospital, 2 nephrologists holding active privileges at Detroit Medical Center facilities, and a vascular surgeon whose research on organ preservation techniques had been cited in international medical literature. They are not alleged to be peripheral figures. They are alleged to be essential ones. Federal prosecutors further allege that 4 hospital administrators, 2 pharmaceutical logistics executives, and a licensed customs broker facilitated different operational layers of the enterprise. The customs broker, identified as Marcus T. Endries, 48 of Bloomfield Hills, Michigan allegedly managed the cross-border transportation documentation that allowed harvested organs to clear international checkpoints, labeled as human tissue research specimens under a falsified nonprofit research exemption. 2 additional individuals named in sealed indictments remain at large as of this writing. Interpol red notices have been issued. The estate returned for a moment to Strathcona Drive. Federal agents spent 11 hours inside Mukhtar's Palmer Woods estate on that Tuesday morning. The structural inventory of what they found reveals not merely wealth, but architecture of concealment. Behind a false wall panel in the primary study, triggered by a release mechanism behind a built-in bookshelf, agents discovered a climate-controlled document vault containing 34 encrypted hard drives, and 4 physical ledgers written in a combination of Arabic and medical shorthand, and 219 laminated cards bearing patient identifiers cross-referenced with surgical outcomes and buyer codes. In the basement, a fully operational medical records shredding unit of commercial grade, still warm to the touch when agents reached it at 7:03 a.m. Someone inside the house had attempted to activate it before the breach was complete, in the primary bedroom closet behind a row of bespoke suits from a London Savile Row tailor, $847,000 in banded U.S. currency. In a fireproof safe concealed beneath a limestone floor tile in the wine cellar, 3 passports issued under different names by 3 different countries, a loaded .40 caliber Sig Sauer pistol, and a single burner phone displaying an outgoing call made at 6:11 a.m. Just 3 minutes before the tactical teams moved, the call lasted 4 seconds. Investigators are working to determine who received it. The arrests. At precisely 6:17 a.m., the Palmer Woods breach was one of 19 simultaneous law enforcement operations executed across 4 states and coordinated with Canadian federal authorities in Ontario. In Chicago, Illinois, Dr. Farag Omonoff, the former transplant chief, was taken into custody at his home in Lincoln Park as he dressed for hospital rounds. He said nothing. His attorney issued a statement 6 hours later describing the charges as baseless and deeply troubling. In Houston, Texas, a surgical team was interrupted mid-procedure at a private outpatient facility. Federal agents in surgical masks entered the operating theater. The procedure was halted. And the patient, a 67-year-old man from Bahrain who, according to investigators, had paid $1.9 million for a kidney, was transported to a Houston trauma center for evaluation. He has since been interviewed by federal prosecutors. In Atlanta, Georgia, Dr. Yolanda Ferris Braxton, a Johns Hopkins-trained vascular surgeon with 17 years of clinical practice, was arrested at Hartsfield-Jackson International Airport as she prepared to board a flight to Dubai. She was carrying $214,000 in cashier's checks and a one-way ticket. In Windsor, Ontario, Canadian Border Services Agency and the Royal Canadian Mounted Police executed a simultaneous raid on the clinic-embedded surgical suite. 3 individuals were detained pending extradition proceedings. In a coordinated financial action, the U.S. Treasury Department simultaneously froze 41 bank accounts across 9 financial institutions, locking an estimated $340 million in traceable criminal proceeds. The victims. They do not appear in charging documents by name. Federal law shields their identities. They appear instead as patient codes, alphanumeric designations in ledger columns beside organ types and weights. But their impact statements submitted to the court through legal advocates from the Michigan Immigrant Rights Center speak in language that no ledger entry can accommodate. One statement, read aloud by an attorney during the unsealing hearing, describes a woman who sought treatment for recurring migraines. She awoke from what she was told was a diagnostic procedure to find a surgical drain in her side and a recovery nurse who would not answer her questions. She was discharged within 18 hours. She was told she had received a diagnostic laparoscopy. She was given a pamphlet about headache management. She was never informed that one of her kidneys had been removed. She learned the truth from a federal victim notification letter delivered to her apartment in Dearborn 17 months later. She was 31 years old at the time of the surgery. 89 people carry that truth. 89 people who came to a medical institution seeking care and were instead inventoried as supply. The gravity of that sentence should not be processed quickly. Sit with it. The charges. Doctor. Adnan Sharif Mukhtar faces a 34-count federal indictment, including charges of organ trafficking in violation of the National Organ Transplant Act, conspiracy to commit wire fraud, money laundering, conspiracy to commit involuntary servitude, aggravated identity theft, and obstruction of justice. The maximum aggregate sentencing exposure across all counts exceeds 180 years. At his arraignment in the Eastern District of Michigan Federal Courthouse, Mukhtar entered a plea of not guilty. He was held without bail after federal prosecutors successfully argued that his possession of multiple passports, access to international funds, and the intercepted 6:11 a.m. phone call constituted a documented flight risk of the highest order. He stood at the podium in a charcoal suit. His face showed nothing. But the system that let it happen, this is not solely the story of one man's criminality. That would be too comfortable. The Great Lakes Medical Consortium passed 4 state health department audits between 2018 and 2023. Its surgical facilities maintained full accreditation throughout the investigative period. Its financials were reviewed by a licensed external auditing firm, and Brasor itself, now under federal scrutiny, and cleared without exception. The 89 victims were predominantly low-income, non-English-speaking immigrants. Their post-operative records were falsified by licensed medical professionals. Their complaints, in the rare cases they were ever formally voiced, were absorbed into a system that had been architecturally designed to dismiss them. Federal prosecutors describe this as systemic exploitation of institutional trust. They are being precise. This was not negligence. This was design. The Senate Judiciary Committee has opened a parallel inquiry into oversight gaps in accreditation standards for outpatient surgical facilities. The Department of Health and Human Services has announced an emergency audit of 1,400 clinics operating under similar consortium-based administrative structures nationwide. Those audits are ongoing. Aftermath and sentencing timeline. As of this report's publication, plea negotiations are reportedly underway with several of the 23 arrested surgeons. Legal analysts expect cooperation agreements will generate additional indictments extending into insurance fraud, Medicare billing manipulation, and potentially bribery of state-level regulatory officials. The 2 individuals named in sealed indictments and currently at large remain the subject of active international fugitive operations. FBI Assistant Director Gerald Vance, speaking at a press conference, offered language stripped of uncertainty. "We will find them." Mukhtar's trial is scheduled to begin in the Eastern District of Michigan in Q3 of this year. Prosecutors have indicated they will seek the maximum sentencing range. The estate on Strathcona Drive has been seized by the federal government under civil asset forfeiture proceedings. The hawks that nest in Palmer Woods do not know this. The gas lanterns still burn at dusk. The hedgerows remain manicured. But behind those walls, the silence is now federal property. On a conclusion, a warning, the architecture of this crime did not emerge from chaos. It required credentials, institutions, licenses, regulatory relationships, and the profound, weaponized trust that patients place in physicians. It required that certain patients, poor, immigrant, linguistically isolated, systemically underserved, be calculated to have less recourse, less visibility, and less likelihood of being believed. That calculation was correct for 7 years. It was not correct on the morning that Devontae Simmons looked at a surgical scar that did not belong in a cardiac arrest case and decided that noticing it was part of his job. 1 forensic pathologist's assistant, 34 encrypted hard drives, 89 victims, 23 surgeons in handcuffs, $1.5 billion in alleged criminal proceeds, 19 simultaneous raids across 4 states. The system failed. Then, slowly, imperfectly, and with enormous cost to those it had already failed, the system responded. Whether that response is adequate is a question you are permitted to answer for yourself. Whether the gaps that allowed this to persist for 7 years have been closed is a question that, as of today, remains open.